Good morning.
Send it patriotically, like a drunken sailor.
I'm not calling on you.
Probably Carl's not either.
It's 12 o'clock.
Good afternoon. This is August the 10th and special Board of Supervisors meeting. On the agenda this morning, we'll be discussing the Public Health Director's update with the recent issues, actions, events, and county responses to the COVID-19 and taking any necessary actions based upon these updates. Madam Clerk, can I get a roll call of the other board members?
Yes, ma'am. Supervisor Angus?
Here.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
We have a quorum.
Okay, I'll turn the floor over to Denise Burley then for her updates.
Madam Chair, members of the board, good afternoon. I'll always start with the numbers, so we'll get that going. There have been a total of 3,197 cases in the county to date, 1,841 recovered, 158 deaths. The average age of cases is 48, and the average age of deaths is 77. Some additional facts of note. This has been our second big week of decreases of confirmed cases. We had 149 cases last week, so that's a big, big improvement. And we want to thank all the people out there who are taking all the steps, these preventive measures, seriously, and wearing your mask, staying home when you're sick, and taking all those steps necessary to prevent the spread of the virus. We are seeing a decrease throughout Arizona, as you've probably seen and heard on the media, and our epi curve currently looks very similar to the state of Arizona's. So that's a good sign for Mojave County.
Good.
Senior living facilities continues to be just a small part of our cases. This suggests that the work being done by nursing staff to support facilities and assist when there is a case has been effective, or at the very least has mitigated more severe results. So a big thank you to all of those people working in long-term care facilities, assisted nursing, and to our nursing staff for their assistance in this work. I have, just so Supervisor Angus and Supervisor Johnson, there were two specific questions that you have asked. Supervisor Johnson has asked about incomplete data, and Supervisor Johnson, we're working on that answer for you still, and I should have it to you by this afternoon. And Supervisor Angus, you were asking about Valley View Medical Center, and I did get an email back from their CEO to talk about how the work that they're doing, and that they have completed over 500 tests at their facility. Just in the last week, they had 5 new positive cases, and they continue to work with our staff on those cases and any other issues that they see within their hospital. I wanted to give you an update on, sorry, was there a question?
Madam Chair,
Supervisor Johnson, go ahead.
what about professions?
We're actually in the process of adding that question to the questionnaire so that we can collect that information, Supervisor Johnson. That wasn't something that was previously collected unless they were a healthcare worker. So that'll be part of the investigative process. Was there any other question with that one, Supervisor Johnson?
No, that should do it. Just seems like, nationwide we should have been doing that. So if we could see a trend going on with one profession besides healthcare workers, whether it was first responders or whoever.
Certainly.
Thank you.
Absolutely. Okay, let's see here. Okay, update on investigations and contact tracing. All cases, except maybe the weekend, we're still working on the weekend cases that can be assigned or are assigned to an investigator. 2,000 cases have been completed, 1,000 cases are active, and these may be approximations. I asked for this information sort of late in the morning, so I don't want to hold my epi person to an exact number, but they're relatively close. We have about 400 are missing phone numbers. The new investigators are looking those up and putting some efforts towards finding these particular numbers and making sure that we can make contact with those individuals. And 600 are being worked by nurses and the case investigators currently. So in the midst of this, we're getting caught up very quickly, and we will also be, for those individuals, sorry, let me catch my note here. If they are past their isolation period, we're still planning to interview them, and if still within the window for quarantining contacts, we'll get that information and make sure that we follow up with all of those contacts. If not, we ask about recovery to see if we can start collecting some data on that end of it, so talking about their recovery. So because we're getting caught up on those particular cases and those investigations, well, we still have a little ways to go, and we'll do some work with those individuals that are outside of their isolation window. We are in a place where the schools are going to need additional assistance from us moving forward, and that is with guidance and direction and looking at numbers and data to help them make decisions. So we started with a meeting on Thursday last week, meeting with all the administrators, school administrators. We actually have another meeting this afternoon at 3 o'clock, and we are compiling information, building decision trees for them, as well as looking at other information that they may need to help them make decisions. Of the 3 metrics that were pointed out on the data that, or the guidelines last week, to be clear, 2 of those at this point we can provide. I'm not certain that we can provide the positivity rate at this point because we currently get that from ADHS. So it would be, we would need to learn if we can break that down any further by community, because they're asking for community level data and case numbers so that they can make decisions based on their specific community that they serve. So we'll be working with the districts on that piece. Okay, let's see here. I wanted you to be aware of an opportunity that was presented to our county as well as all the others in Arizona. ADHS has announced that counties that are interested in funding for environmental health enforcement of governor's executive orders, if we're interested in those funds, they're going to supply those funds in a lump sum. That'll be $25,000 for smaller counties, $50,000 for the larger counties. And it's really, we did express interest in receiving those funds. Our EH team has been very involved in responding to any complaints from the governor's orders and responding in such a way that we provide education, and it takes time and energy to do that. So that'll help with some of the funding for those activities. It's uncertain at this point when we will receive a contract. I believe it will be sent to the AG's office shortly. But that'll be additional funding that we can use for those type of efforts.
Okay, does anybody have any comments on that?
Madam Chair?
Supervisor Angus?
Thank you. So within the contract, are there any requirements for the type of oversight or the response, how the response goes, or is it just up to the counties?
Supervisor Angus, thank you for asking that question. I haven't seen the language in the contract, so we'll have to read through that in greater detail, and then I can certainly respond to your question more accurately. My understanding at this point is that it's primarily education-based. It's, of course, taking that initial step or two to make sure that a place of business understands the executive order and what's expected before we take any kind of other action.
Okay. If anything's different, you'll let us know, right?
Certainly, absolutely.
Okay. Thank you.
Certainly. We've received information from ADHS regarding vaccine trials that will occur throughout the country, but there will be some places within Arizona that there will be a place that people can go and sign up and go and participate in these trials. Primarily, those will be in Phoenix and the Tucson areas. Additionally, and in support of that, there's an operation called Operation Warp Speed that the federal government has implemented, which is to provide facilities for these clinical trials to occur throughout the country. Arizona will receive 17 of these trailers. We do not have any additional details at this time regarding where these may be located throughout the state, but as we learn more, we'll certainly provide that information to you. It would be a pure assumption, but I would think that at least a couple, if more, will be located in the Phoenix metro area and also in the Tucson, Pima County area. We are the ADHS Projections and Modeling Work Group, which is working out of Northern Arizona University, has developed some modeling for all counties. And this information will be made available to us soon. We have requested it for our county, and we hope to receive that in the very near future, possibly even by the end of the week. So if we do receive it by Thursday, I'll make sure that we forward it on to you.
Okay.
Okay. All right. Any questions on that part of it before I move on?
Supervisor, any questions? Seeing none, Denise.
Okay. All right. So I wanted to come back around to the dashboard and the web page and the fact sheet that was developed. After the meeting last Thursday, I believe I captured everybody's comments and feedback and have made some revisions to that particular document. And I sent that about 11 o'clock this morning to everybody so that you could take a look at that. I did plug in some information just to bring it up to date, but it's still really all fictional, if you will, because it's not all accurate. And I don't want to give anybody the impression that every piece in there is current data. But I wanted to go back through this and see if it addressed the questions and concerns. Supervisor Gould, I added in the recovered number. Supervisor Angus, you can see in the bottom right or bottom left corner, we've got the community level data, or at least broken down more than we have by service area, which, mind you, will be very helpful when it comes to the schools and having that information available to schools so that they can be making decisions based on that as well. And then just some clarification that it's PCR tests. And I know the version I sent to you may not have included that, but I did make that adjustment. So it's laboratory PCR tests. So people are clear that it's not the antibody tests. I modified the percent, so we changed it to case fatality rate instead of percent of people who die. So we've adjusted. And then the second page of this document is a description of how things were calculated and a definition, if you will, of what it actually means, so that you can refer to that. And then Supervisor Bishop, you had asked for zip code level data, so I added the web page address for that through AZDHS.
Thank you.
Additionally, County Manager Elters had requested that underneath the COVID cases in the upper right, that we provide some kind of clarification or information about, description about how the cases are trending, up, down, maintaining. So I did put some language in there, and I'm happy to modify that in any way if there can be, if you'd like something different. But Were there any other changes to that particular document that anyone wanted?
I guess not, Denise, thank you. Looks very nice.
Okay, and at this point, we had not made any other further changes to the development webpage. But the development webpage, as you know, had the epi curve and some more detailed information on, and part of graphs and more interactive and dynamic and fluid. So that part had not changed, and I wanted to make sure I didn't miss anything on that. Did anybody have any changes and recommendations for the webpage?
Manager Elders, did you have any comments on?
Madam Chair, I do not have any additional comments. I did have some comments early on, discussed them with Denise last week, and I'm satisfied with what we have as a final version now.
Okay, good job, Denise.
Thank you. Thank you. I think
Chairman Bishop, if I can just interject.
Yes.
At the Thursday meeting, there was uncertainty as to the direction that the Public Health Department could go. I'd recommend, if we haven't got to that point yet, but I'd recommend that the board approve the suggested changes on the, what do you call it, the worksheet, or that you just
The
did?
fact sheet,
The fact sheet, and also approve the changes on its website. I'd recommend the board take a motion to that effect.
Okay, I'll entertain a motion.
Madam Chair,
Yes, go ahead.
can the county attorney explain why he thinks that's a good idea?
Certainly.
I think it's a great idea because last Thursday there's a whole lot of uncertainty. You know, the Public Health Department wants direction. They want guidance. They want to be able to say, you know what, this is what the supervisors want. If the supervisors approve by motion, then the Public Health Department knows exactly, okay, this is what the supervisors want, and this is what we can move forward with. Otherwise, they don't have that kind of direction that they need.
Well, I'm pretty sure they have the direction now because they've already voted on it.
We haven't voted on it yet.
We voted on it to begin with, what the time would be. What you're asking for now is for us to vote to change the time that we've been getting it.
No, I'm not asking to change the time. That's not what I'm asking for yet. And I think, and we could debate that, or you can debate that at a later time. What I'm recommending right now is to approve the fact sheet and approve the changes to the website.
Okay, having,
I would make a motion, Madam Chair, to go with the new website as proposed by the health director.
okay, would that include the fact sheet as well?
I'm not exactly sure what the fact sheet is he's talking about.
Certainly.
Okay, Denise, can we put that back up on the screen?
Certainly. Here we go.
There you go, Supervisor Johnson. That's what we're calling the fact sheet.
It hasn't shown up yet, Madam Chair.
Oh, okay, okay.
Madam Chair, may I make a comment before, as it goes up?
Yes, go ahead, Supervisor Angus.
Did we vote on the original one that went up? When Public Health put up the original website, did we vote on that?
I don't recall voting on that, Supervisor Angus, but now that we're making changes, I think the county attorney is recommending that because we're making changes that we vote as a board on approving that. That's my understanding anyway.
Well, I'll go along with it, but I just really don't see the necessity of it. So.
I mean, really, the point is just trying to get direction to the health department. If you don't think that we need to vote on it, okay, let the health department go forward and make changes as appropriate. I'm just trying to give as much direction as we can to the health department as possible.
So Supervisor Johnson, Supervisor Angus, so clarify for me if I get this incorrect, of course, but Supervisor Johnson specifically, you voted last Thursday, if I understand correctly, on the process, correct? To keep the process the same?
Yes, Madam, or yes, Director.
Okay. And so I think last Thursday, that was what the vote was, not so much specifically about the web page per se and the fact sheet, but about the process itself, because the process would change. We would provide this particular fact sheet at approximately before 11 o'clock the following day. Currently, what you receive is a daily summary, which is how we've been working our rolling count. At the end of each day, that information, as we've discussed before, is used to update our webpage. And then in the morning, you get several different reports. You get a daily report, which includes numbers that have been deduplicated, cases that have been removed from our jurisdiction, cases that have been added to our jurisdiction, and changes that have been made, which normally occur. That's why that data is very dynamic, so it makes those adjustments as we go along and corrections. And then you get a hospital capacity report. So the web page redesign really is there to incorporate some of those hospital data questions and to aggregate that information into a larger graph for everybody, including the public, to see. And then the fact sheet that you see in front of you would include all the information or very similar information along with the web page to what you already receive in the morning. So it would all be deduplicated, accurate, point in time accurate, realizing, but still the most accurate information that we can give you at that point in time.
Madam Chair?
Supervisor Johnson, go ahead.
Thank you, Madam Chair. Yes, this is what I was worried about. We're putting a whole lot into one motion. I have no problem, and I doubt that anybody else does, with the redesign of the web page. Of whether we need a motion or not for that, I'm sure it would pass. It's the timing of the information that the board receives and the public receives. We're now at 3,000 cases, and I believe that, like Pima County puts theirs out and they say as of 5 o'clock this is what we have, and then they add whatever the next day when they put it out. I believe that we have, people are used to getting their news at 6 o'clock in the evening. Also, the newspapers are used to reporting in the morning, what the following day's reports were, instead of being 2 days late. When we go back over this last weekend, when we talk about getting more up-to-date information, we had 17 cases with one that wasn't, only one that wasn't under investigation, 13 cases, one that wasn't under investigation, 28 cases where 5 weren't under investigation. That's 58 cases with 7 that weren't under investigation. I believe that it's important that we continue to give out the information in the evening, whether we say we cut it off at 5 o'clock or 4 o'clock, whatever time we do it. I think that's important to the public. They've come to expect that from us. I think that's the best possible information we can get out. And another question I would have is, are we still going to have the information that's sent to us under attorney-client privilege from the county attorney every afternoon or evening?
Right. Supervisor Johnson, the goal was to try to streamline the process, which would, in essence, would mean that we would not send that evening daily summary report. And in large part, what we're trying to do is give you more information, if you will, in the morning, the following day, and recognizing that at least the first day, that will be a longer time frame without data. But after that, it would be the same time frame, basically. We would have a cutoff of 4 o'clock the previous day. We would compile that information and have it to you by 11 o'clock, before 11 o'clock on the following day. So it wouldn't be immediate. In order to provide you with this same format, we'd have staff at the office until probably 8 or 9 o'clock at night. So we're trying to be sensitive to our staff time, but be very mindful of the information, the importance of it to the community and to all of you.
So
But it
Denise,
appears to me that what we're going to, oh, sorry.
Denise, this reporting change will bring us more in line with what ADHS is reporting, so those numbers should be closer.
Well, keeping in mind that ADHS still reports probable cases on their webpage.
That's true.
So because we've made that decision to stay with confirmed cases, those numbers will never match. So that's just the nature of the beast.
Supervisor Johnson, go ahead.
Thank you, Madam Chair. But our numbers are going to be so far off then because the county is saying we're going to cut off at whatever, 5 o'clock, and then we're not going to report until 11 o'clock the next day or before 11 o'clock the next day. The state reports at 9 o'clock the next day. So they're going to have all the cases that they collected the day before, which we aren't even going to have. So I think we're going to have just a hodgepodge of numbers, plus now the board is not getting any updates where we can answer questions because all of us get questions all the time. We just might as well be on the press release list with everybody else in the county or the state because we have no more information.
Madam Chair.
Go ahead, Mr. Alpers.
Madam Chair, Supervisor Johnson, you are right, and we may have some discrepancy with the numbers reported by the Arizona State Health Department. However, we have been trying to address the discrepancies that we have within our reporting at Mojave County. This whole effort is in response, direct response, to addressing that discrepancy and be consistent between our press releases and the data that is released daily. And just last week, putting the two side by side, looking at the press release and looking at the data that the health department collects, we had nearly 100 cases difference between those two. This, going forward, will enable us to continue our reporting once a day at that AM hour that we believe will be timely for the midday news cycle and for the printing, for the printed media. At the same time, it will be consistent with whether you're looking at our website or whether you're looking at the fact sheet or whether you are looking at the press release. So your point is well taken. I don't know that we have the perfect recipe, but we believe this is a reasonable approach. After all, by now it's the trend that is probably more critical, more important than the specific number. So we're trying to meet the best of both worlds and provide an accurate, balanced set of numbers that are consistent and the public can rely on. Thank you, Madam Chair. Thank you, Supervisor Johnson.
Thank you.
Madam Chair?
Can I make one more point, Supervisor Johnson, before you comment, or would you like to comment first?
No, go right ahead.
Okay, thank you. I just want to be clear, too, ADHS is also reporting on the previous 24 hours. So their cutoff time is 5 o'clock for their reporting, and they report at 9 o'clock the following morning. So ours would be a cutoff time of, say, 4 o'clock, and then we would be reporting before 11 o'clock the following morning. So, I mean, the timing is pretty close. So I think, it's a compromise there for us to try to reach that and get you accurate numbers moving forward.
I guess my concerns come from, like I pointed out, that we had 58 cases and only 7 that we had investigations partially done on. And when we gave extra bodies, and I thought we said that we're going to put one person on doing the old cases to try to get them up to date, and that we were going to put all the new people on the cases so we could tell people if there was a trend or something that was happening. I guess the most important thing that I think of is, well, there's two things. One thing is if we cut off at 5 o'clock, we don't report to the next day, the newspapers get it out the following day. That's 2-day-old news as far as they're going. I think we've seen, like you mentioned before, a drastic reduction in our cases, which is good. I think we'll see a relaxing of things in the county. But what I'm worried about is that people don't continue with the mask and the social distancing, and that we might have to go to extreme measures again if we see the numbers go up. And if you don't report it out to the people what's going on, they forget very quickly. I guess that's my point. And I'm done beating that horse. Thank you.
Yeah, I understand the timeliness, certainly, Supervisor Johnson, and the need to have information out to the public and to all of you to use as a basis for making decisions. Data is always a little bit behind anyway, and looking forward, we really, our focus is on the accuracy of that data moving forward to ensure that you have the most accurate available. And that's just where we're at the moment.
Madam Chair.
Yes, Manager Elters.
Madam Chair, Supervisor Johnson, Denise, if you would confirm to Supervisor Johnson that that is the case as far as the tracing.
Yes.
All but one are taking care of current cases, and there's only one investigator that is going back and checking on the recovery process just to collect some data that would be of value as we go forward. I just wanted an opportunity for you to confirm that, please.
And I'll make sure that I address that question as well and confirm that. The other piece to that is to know that Supervisor Johnson, on the weekends, is that we don't have our investigators working currently on the weekends. So the only way for them to investigate those cases, to get that information included in those daily summary reports, would be for them to call on that first day when we report out that case. And as I mentioned initially, when we started out, we were able to call that day, and we were able to reach and talk to that person that day. It's become more challenging to do that. So there are times when we're unable to reach people the first day. They don't call us back. We may be searching for that phone number. There's a variety of reasons, of course, but we do try to get that information as quickly as we can. And then as we learn that and it's uploaded into the system through the interview process, we do include that in the rest of the data, and the picture is more complete for us.
Okay, any further comments or questions? Supervisor Johnson, you still have a motion on the floor to approve the website, and I think we were wondering if that motion needed to be amended to include the fact sheet. So what are your desires?
Well, Madam Chair, I would make the motion to only approve the website and the fact sheet. That would be my motion.
Okay, we have a
Not
motion.
the time.
Motion on the floor. Do we have a second?
I'll second that.
I have a motion and a second. All those in favor, say aye.
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 Any opposed? Okay, motion passes, and you have your direction on that, Denise. Thank you very much.
Supervisor Bishop, could I ask one question before we move forward?
Yes. Please do.
Can we use the information from the website and from the fact sheet to update the web page, which would be not until the following day, so that way we are using that accurate information to update our web page rather than the rolling total, which is what we've been doing as a result of the case summary that we send you at the end of the day.
Okay, do we need a motion for that? Or just direction?
I don't think you need a motion.
Okay.
You're updating the website, and it's not disrupting the flow of information that Supervisor Johnson talked about, correct?
Yes.
So you're still following the guidance and direction that the supervisors have previously provided, as outlined by Supervisor Johnson. This is something entirely different from it,
Perfect.
within your purview to be able to do.
Okay, thank you. Appreciate that clarification.
Okay,
Okay?
Thank you.
I didn't have any other updates.
okay. Does anyone have any questions of Denise? Okay, seeing none, we'll move on to item number 2, discussion and possible action, reference the Arizona CARES Act money. There's no backup material to support what you're asking for, Supervisor Angus, so do you want to take the floor and explain this to us?
Sure. There's no backup material because I'm not really asking for anything. I just wanted a brief update. I don't know about the other supervisors, but I've been getting a lot of questions from fire districts and local agencies. There's some misunderstanding about exactly what the Arizona CARES money can be used for. And the way I remember it from our budget, I'm being told that it's wrong. So I just wanted clarification so everybody knows exactly what this money can be used for and how how we made the decision that led us to make the decisions that we did as a county.
Okay, County Manager Elters, can you remind us and give us a summary of this, please?
Thank you, Madam Chair. Supervisor Angus, I'll be happy to. I will be brief, and it will be just a short summary. If you recall, federal funds were made available for COVID-19 related expenses with some conditions and constraints. Those specifically were intended to pay for public health and public safety, such as salaries and benefits, and that was to be from March to December of this year, of 2020. Also, those expenses that were not covered by any other federal dollars. So Mojave County submitted an application, a request, under those terms and conditions to utilize the federal funds related to COVID for salaries of public health and public safety, complying with the terms and conditions, and were approved and received $9.1 million for those applications, those purposes. We know that the cost of salaries to the county for public health and public safety for that period is $9.8 million, which is greater than the $9.1 million that was approved for the county for that purpose. So to Supervisor Angus's point and question, there was no discretionary funds left to be distributed or shared with any other entities, and understanding that the cities and other entities had opportunity to apply and receive funds at an appropriate window in time. I would also add that given that those dollars were approved for public health and public safety, it would be changing the terms and conditions of those funds if we were to share them with any other, either fire district or any other entity, and would be changing the terms and conditions which were the basis for this grant of funds. So understanding that Supervisor Angus is inquiring and want to understand better, or perhaps assurances that those dollars are being applied as intended and as approved and granted to the county. So the only other comment that I would make is there are a number of independent fire districts within the county, and if you were to try to accommodate one of them, then you would have to be fair enough and consider what happens with the others. It would be a precedent that perhaps would not be desired or recommended. And I will stop here. Supervisor Angus, I hope I provided an outline or a brief summary, but I'm happy, along with Coral and Ryan, to answer any additional questions you may have.
Okay, thank you very much.
Chairman Bishop, can I ask a follow-up question?
Yes, go ahead.
I think the misunderstanding and the confusion comes from the fact that other jurisdictions are doing things that seem to be outside of what you said, the parameters of this grant are, such as sharing it with local nonprofits or helping out local businesses, things like that. But you're saying that that is not what this is, but that is pretty much what's happening. So I think people are seeing this in the paper and hearing about it, and then they're like, well, why isn't Mojave County doing that? So I'm glad you clarified that, because that's how you guys understand this grant, correct?
Yes, Supervisor Angus, you're absolutely right. And again, those were the terms and conditions that we included in our application and were approved based on. So, was there some additional flexibility? Could we have gone a different direction? I wasn't here, but I would say at the time the application was made, it was understood by the staff that that's the direction the board wanted to go with, and those were, again, the commitments that were made in the application, which were the basis for the grant being approved.
And for just a little bit more clarification, there is other Arizona Cares money out there for first responders, for nonprofit agencies. I mean, we just got one today, I think, saying that some more money is being made available for housing and things like that. So it wasn't just one pot of money that came in. The Arizona Cares money was the federal money that for some reason just kind of dripped in instead of it coming in at once. But I thank you for the explanation. I think that's all I needed.
Okay. Thank you,
I have a
Supervisor.
question, Madam Chair.
Supervisor Johnson, go ahead.
Thank you, Madam Chair. So when the board has instructed staff to fund additional staff for the health department from CARES money, where is it being charged to?
Supervisor Johnson, I'm going to ask Coral to step up and answer that question. My understanding is it is coming from the CARES Act, because it is part of the public health expenses that are directly related to and warranted under the current grant approval. And
Okay,
Coral,
and then
can you
a follow-up.
Coral, can you add to that, please?
Yes, good afternoon, supervisors. Supervisor Johnson, the county is fronting essentially the cost of those additional temporary services, and then included in the budget was a grant that the health department has applied for and I believe approved. I believe it was about $540-some thousand in that one. But we will be remitting those temporary salaries under that grant for reimbursement.
Okay, I guess as a follow-up to that, maybe I misunderstood the information we received before, but we're taking CARES money, which obviously is supposed to be helping with the pandemic, but it's not important enough for us to have people working the weekends. Are we saying that our people don't work the weekends? We can't have somebody on every day? No wonder, I mean, I don't even know how we're getting 7 cases that we know where they came from if we have nobody making calls Friday, Saturday, and Sunday. I mean, can't we work, split schedules on this?
Denise Burley's coming to the microphone to answer that, Supervisor.
Supervisor Johnson, we are looking into that, and we have considered that as an option to ensure that we have investigations that are going on every day of the week. So I will try to get back with you by the end of the day with an answer to that question, okay?
Thank you, yeah, because I wouldn't have supported just hiring extra people to work Monday through Friday.
Understood.
Okay. Are there any other questions regarding the CARES Act monies? Okay. Any other comments before I close the meeting? Okay. Have a good day.